Hi, my name is Tia McLean. I'm a nursing student at the University of South Alabama, and today I'll be performing the NG2 checkoff. Here's my ID, and I'm going to scan the room. First thing I'll do, walk into a patient room, I'll perform hand hygiene. Then I'll explain the procedure to my patient. I will verify the patient care order form and hospital policy. Okay, then I will list two identifications. His name is Jaguar Jones. Jaguar Jones, his date of birth is 08/25/1963. 08/25/1963. And he's allergic to penicillin. Okay, next, I will provide privacy for my patient. Then I will gather all of my equipment. I'll make sure I have my stethoscope and my pen light. Then I will don my goggles. Okay. I will also check for any vital signs. I will put a pulse oximetry on the patient and check for the oxygen saturation levels. And I'll also take for any vital signs. If there's a decrease in vital signs or a decrease in oxygen saturation levels, I will immediately stop all processes. Next, I will wash my hands again. I will raise the raise the bed to a working height, lower the side rails, and make sure my patient is comfortable. Once I lower the side rails, I will loosen the pump, loosen the syringe, and I'll also establish any queuing signs for my patient. Once I establish any queuing signs for my patient, I will get my tape ready. My tape will be for the measuring, the final fixation, the temporary securing tape, and the labeling. Once I got my tape ready, I measured my thing in a previous video, so I'm not gonna do it here. I will also open my package, my NG2 package, and I'll put the lube. Once I put the lube, I did the syringe, I'll put my gloves on. Okay. Once I put my gloves on, I already measured the tape in another video, so I'm not gonna do that right now. I will get my NG2. I will take the end and then I will curl up 4 inches of it. And then release it. Then I'll put 4 inches in the lube. I would also like to note, I would check for, I would check for patency and smell to see which nose I will be using. And then I also will wash the area with soap or water or an alcohol prep pad. And then I will dry pad. Okay, so now I will take this and I will use putting the curved tip down. I will put it in. Then until I reach the over the nasopharynx. Once I reach over the nasopharynx, I will twist this to 180 degrees, moving in 1 to 2 inches at a time. While I'm doing this, I would also like to note that if my patient starts coughing or is in respiratory distress, I'll move the NG tube back to the posterior nasopharynx, until normal breathing is performed and my patient is sterile, and then I'll have them swallow again. So while I'm moving this, I'll have my patients dry swallow or use water to swallow. Okay, once I reach my marking, I will secure it. Okay, I would like to note I will put my towel down also before all of this. And my basin. And I'll put that in there. Okay. Once I've secured my tape and put that in the basin, I will use a tongue blade and a pen light to check the back and see if I see the NG tube. Once I've done that, I will also like to check and notice if there's any assess for any gastric secretions. I would like to assess if the pH levels is indicated, and I also will do an x-ray if it was ordered. Next, I will get my syringe. Put it in here. While I was doing that, I will assess for the gastric secretions, the pH level, and X-rays. Okay, since my this and that is that, I will remove my temporary tape, and I'll use a skin prep pad. Once I use a skin prep pad to secure it, I'll remove my syringe, and then I'll put this on it to secure, and then I will suction. I will use a low wall intermittent suction as noted, so I can suction if it's needed. But if it's not, I'll use a air loop, and then I will place this above my patient's stomach. Above my patient's stomach. And then I'll keep it there. Next, I will remove all. I will lower the bed side rails again. Raise the side rails, lower the bed to a working position, to a more comfortable position for my patient. And I will make sure his head doesn't go below 30 degrees, so he doesn't aspirate. And then I will document the type of NG tube I use, the color, the amount, the consistency of his secretions, anything like that. And then I will clean up my supplies, my towel. Then I will leave, and then once I come back, I will check. I will verify the patient care order form. I'll wash my hands. Patient care order form, wash my hands. I will check to see if this is the right patient all over again. And then once I'm done with all of that, I will remove the tape. And slowly remove the NG tube. Okay. Then I will discard. I would also like to note, as I was putting the NG tube in, his head would have been back. And then while I was keep putting it in, I will lift his head forward as he would have relaxed, and he would have flexed his head forward for me. And then I will, since this is the end, I will document anything that I've seen, his response to everything, and any secretions. And then I will also oral swab his mouth and perform oral swab with the chlorhexidine wipe brush. Thank you.